COVID-19 outbreak. My name is Terence Agbor, and I will be your host for today. On December 31st, 2019, the government of Wuhan, China, confirmed that the health authorities were treating dozens of people with atypical pneumonia of unknown cause. Researchers in China later on identified the virus causing this illness as a novel coronavirus resembling the virus that caused SARS and MERS. On January 20th, several countries confirmed cases, and on January 30th, 2020, the WHO declared a public health emergency of international concern due to the spiraling numbers of new cases in China. The number of infections continue to spike worldwide, and on March 11 this year, the World Health Organization declared COVID outbreak a global pandemic. According to the WHO, as of today, March 21st, 2020, over 224,073 cases have been confirmed worldwide. Of those numbers, 9,840 people have died in over 177 countries and territories. Yesterday alone, Italy registered the highest number of deaths in one day. More than 600 people died, all of them suffering from COVID-19. As a result of these soaring numbers of new cases and the increasing mortality across the world, several countries have implemented various public health measures to limit the spread of the disease and the burden. Some of these measures include travel restrictions, shutting down international borders, temporary closure of schools, daycares, and recreational centers, social distancing, isolation and quarantine of infected people, and in some cases, total lockdown of towns and cities. In some places, state of emergency measures have been activated to direct resources to the needy. The economic, social, psychological, and political significance and implications of COVID-19 outbreak are visible for everyone to see. While all this is going on, many people have exploited the social media to disseminate misinformation about the disease. Today, I have with me three outstanding individuals who have generously agreed to share their knowledge on COVID-19 with emphasis on how to minimize the exposure and contain the spread of the disease and the virus. Ladies and gentlemen, thank you very much for accepting to take your time off your busy schedule. I can see some of you are at work to join us in the fight against COVID-19 through education. So with me today, I will introduce each of you. I will start with our only lady of the panel, who is Dr. Mah-Fri Fomukong. Myself and Dr. Mah-Fri come a very long way from the University of Buea far back. And she did her undergraduate studies in microbiology before pursuing a medical degree. She is currently the American Academy of Family Physicians delegate in the state of Georgia, USA, and she's board certified in family medicine. Good afternoon, Mah-Fri, and welcome to the big debate. Okay, so our next guest is Dr. Arnold Onana. For those of you who frequently come to the big debate, you may have seen him before. He's a Cameroonian trained physician and also holds a master's in public health. So he has a strong interest in protecting people from this kind of infection. He has a passion for health system policies and what they can deliver to meet increasing needs of the health population. Good afternoon, Arnold.
Good afternoon, sir. Thank you for having me once again on this very, very wonderful platform. And good afternoon to everyone who is listening to us wherever you may find yourself today.
And my third guest for today is Dr. Ayukekbong James. Myself and James as well, we come a long way since we were, I believe, 9 or 10 years old. And he did his initial training in medical laboratory science at the University of Buea, and he holds a PhD in medical science and molecular epidemiology. He is certified in infection control, so he's one of those people who really want to talk to at this time. And he is a practicing infection controller in Canada. He's also a member of infection prevention and control in Canada, and currently he's the executive director of Epitech Public Health Canada. So, James, welcome once more and good afternoon.
Good afternoon, Terence and fellow panelists. It's always a pleasure to either be taking part in the big debate Cameroon or to be an audience or part of the audience. It's my humble pleasure today to share my insight on this very, very interesting subject, COVID-19. Thank you so much for having me.
Okay, so ladies and gentlemen, what we are going to do is I have a few questions for you, and I believe the audience will also be having some, will also have some questions. We may cover some of that question in the course of our discussion. So if we've covered those ones, I won't ask them. And what I want us to do is to be as basic as possible to educate the public on what they need to do. So James, since I introduced you last and you are the virologist among us, I'm going to start with you. So what is a coronavirus?
Okay, thank you very much. That is a broad question. Anyway, coronaviruses are a broad family of viruses that have animals as reservoirs. And from time to time, there is this spillover from animal reservoir into the human population. So to narrow down, there are 7 groups of coronaviruses that infect humans. They are divided into the alpha as well as the beta coronaviruses. And 2 of them are in the alpha group, and 5 of them are in the beta group. And within the beta coronaviruses, we have the infamous SARS that was responsible for the outbreak in 2002. We have the MERS, which is referred to as the Middle East Respiratory Syndrome, that was also responsible for the epidemic in 2012. And then we have SARS-CoV-2, which is the causative agent for COVID-19, which is also a member of this beta coronavirus family. So what is of interest is that most of the coronavirus viruses, they cause mild flu-like symptoms. But for some reason, this period that I've mentioned, the SARS, the MERS, and COVID, the causative agent of COVID-19, have been responsible for epidemics. The SARS was in 2002, the MERS was in 2012, and now we have COVID-19. So hopefully in the course of this discussion, we're going to talk more about COVID-19 and how it relates or what's the resemblance or difference with the other coronaviruses within the family.
Okay, thank you, Jim. So the take-home message here is the causative agent of COVID-19 is not the only coronavirus. There are many coronaviruses out there, and they usually cause mild symptoms. However, in the last 3 decades, there have been coronaviruses that have caused outbreak, causing mortalities. And so, Arnold, I will go with you with the next question. So, then now that we know what coronaviruses are, so what is COVID-19?
Thank you, Terence, for that question. To keep it as simple as possible, COVID-19 is the disease that is caused by this novel coronavirus, which it has been called the SARS-CoV-2 virus. Like my other panelist, Jim, just mentioned, you have several other coronaviruses that are out there and which have been responsible for one other acute, respiratory disease. This specific disease that's caused by this virus that just appeared has been called COVID-19. So That's to COVID is simply, a contraction of coronavirus disease that appeared in 2019. It's just to distinguish it from the other outbreaks that have have been out there, that have been caused by other similar coronaviruses. So to present that distinction, even though yes, obviously they do carry similarities, this one was specifically named COVID-19, and it also comes, as we'll get into it later on, it also comes with its set of symptoms and signs. Yeah.
Yeah. Okay. Great. Yeah. I mean, you probably read my mind, and maybe you knew the next question I was going to ask. So, Mah-Fri, you are in the clinic as we speak, and so what will you be looking for if a patient comes to you and you suspect that they have COVID-19 infection? So, basically, the signs and symptoms. What should we think of? What should we be looking at?
Thank you again, Terence, and the other panelists. So for the signs and symptoms we're looking for, normally, generally, symptoms go between 2 to 14 days after exposure. Normal cold viruses like symptoms like the common cold, the cough, the sneezing, and the worst ones we actually look for is the fever, the shortness of breath that leads to ARSD, which is the acute respiratory distress syndrome, which leads to potential fatality, is what we're actually looking for. So the diagnosis again is clinical diagnosis, and it kind of ties in with this. They do what is called like the chest X-ray, or in the clinic do a CT scan of the chest that correlates with the time between the acute phase and the time to fatality, basically. So we have all the symptoms that kind of directs us to what we're supposed to do and what we're not supposed to do, basically. So look for your cold-like symptoms, the common cold, the cough, the sneezing, and fever, shortness of breath. That we need to know. We're taking off the traveling because right now we're all exposed. So travel is out. Before, traveling used to be a major factor.
Okay, fantastic. So, Jim, maybe I go back to you. And so, you, Mah-Fri just mentioned that they look from the time some of these symptoms present from the time you get exposed, you might not get start manifesting any symptoms, and then eventually you start manifesting symptoms. So this period is usually called, I know it's called incubation period. So what is the incubation period of this disorder?
Yeah, that is a good question. And the incubation period for most coronaviruses is usually between 1 to 14 days. The incubation period for COVID-19 is also within this range, between 1 to 14 days. But most often, within the first 5 days, that's the mean, people start, kind of exhibiting these symptoms. And just to corroborate what Mah-Fri said, the most common symptoms are, like in mild cases, would be maybe, dry cough, feeling of general malaise, sore throat, and sometimes fever. And I want to say here that there was a study that was published from China during the first 70,000 cases of people who were infected with the SARS-CoV-2. Interestingly, in this study, 81% of people had mild infection. 14% had severe infection, and 5% had critical infection. Critical infections are infections that probably culminate in the ICU, and they have the complications associated with pneumonia and things like that. So, in as much as the population is very, very anxious, people are scared, people are worried, the coronavirus often cause mild flu-like symptoms in otherwise healthy people. But in people with other comorbidities like heart disease, diabetes, lung disease, cancer, the elderly, disease might be severe or critical. Okay, so yeah, I just want to put that there, and as we go along the discussion, the clinicians will probably elaborate more on that. Thank you, Terence.
Okay, yeah. Thank you, Jim, for mentioning that. I think that's also very important when we start talking about the prevention and why isolation and social contact is very important, especially for those people who are vulnerable. But before we get there, my next question is we'll go to Arnold, and like with this one, it's a little bit broad. So after Arnold, any of you can jump into it. So how is this disease spread? How do we get this disease? Arnold.
Yes, thank you. I really want to keep it simple. There's a variety of ways, from which organisms would live from one person to another. In this case, we're talking about this virus, which is responsible for our COVID-19. And if you look at the main ways through which this virus is going to come into contact with someone who doesn't have the disease or hasn't, been affected yet, then you can, easily see through which ways someone will be contaminated or someone is going, how the transmission is going to happen. So it causes a respiratory disease. So it means that your virus is also going to be released, mostly through droplets that come from the respiratory tract. So this virus is going to come out from the respiratory tract. So there are two things that can happen. They're either going to stay in the air, in the form of droplets that can be inhaled by others, or they are going to land on surfaces. Those surfaces could be skin, could be tables, could be plastics, could be metals, there could be a variety of surfaces upon which this virus is going to land. Now, if the virus is, containing droplets or any aerosols, in the air, and someone breathes or inhales, breathes in those droplets, or it comes in contact with maybe the eyes or the mouth, then yes, that virus can land on you and begin its journey, towards completing whatever it came to do in the body.
The lungs, yeah.
Yes, it could also land on surfaces. It could be on a table. It could land on, I don't know, on clothes. It could land on skin. It could land on hands. So sometimes that's why when we work, we'll go into methods that you can use so not to be infected. We would say don't cough into your hand, but cough somewhere else, on tissue, because you could cough on your hand and greet somebody else or touch somebody else, and then the person is infected. So you could get it. You could through your eyes, through your face. That's why I say don't touch your face. You could inhale it through your nose or even through your mouth. Those are all places, through which we could get the virus into our bodies. So like you said, this is vast, but I'm trying to keep it simple.
Yes. Yeah.
That one, in the air, there is something in the air that you can breathe in, or there is something on the surface that you can touch and then transmit it through all those points of entry in your body. Yes.
And like just to add there, like the face, like we hear every day, don't touch your face, try not to touch your face. The reason is because the face has three main portals of entries. You have the mouth, the eyes, which has mucous membrane, the nose as well, which has the mucous membrane. So these are easily accessible by these viruses. So that is why when we go to the prevention methods, you always hear like everything all over the news, they always say Don't touch your face. Don't touch your face is basically because you can get in contact with the virus by touching its surface, and then accidentally, all of us, like, I mean, I've been sitting here even when Arnold was talking. I can tell you he touched his face 3 times. I've touched my face here at least 5 times since we started. So we do that unconsciously. So that is why it is very, very important. Okay, so then,
sanitize.
okay, so I don't know if Mah-Fri or if any of you have anything to add with that on with respect to the mode of transmission.
The only thing I want to add about transmission is the distance. There's a big deal on distance, the 6 foot and the 3 foot distance. Other words, 2 meters and 1 meters.
Yep.
So the person-to-person transmission is within 6 foot or 2 meters for those of us using the metric system back home. It's 2 meters. So guidelines say if you're out of that 6 foot range, you're kind of covered. And 3 foot for mucosal transmitted versus like droplets, coughing and sneezing. But does that mean we shouldn't do what we're supposed to do? No. These are just guidelines. It's going to help the transmission of the disease. So keep in mind the 6 foot rule and the 3 foot rule, just in addition to what Arnold said.
Yeah. And Jim, do you have anything to add? Because I definitely have something to add.
No, not really. I think Arnold and Mah-Fri has really highlighted on the main aspects that are related to transmission. You know, the aspect of, you know, touching your face gives an easy access of the virus if your hands were contaminated into your body. And also if you are less than 2 meters from somebody across, once this person sneezes or coughs, the virus can spread to you through droplets. So that's very important. And that's why so far people are really emphasizing on social distancing. The whole concept of that is that people should not congregate together. People should not, you know, like, people should be really like distant away from one another. And once that is done, the virus transmission chain will be broken. So the virus will not be able to skip or to jump from one person to the other.
Yeah. So fantastic. So that's very important. So for partners at home, you people come in close contact. So if your partner has flu-like symptoms, kissing should be avoided during that period. This is very important. I have to mention that. Yeah. So we move. Okay. Yeah. So the next question now goes to I'll go to Mah-Fri now. So who is most at risk of infection with SARS-CoV or the COVID-19?
Well, by the way, everyone is a risk, but you use the word most.
Yes.
So we'll start with the elderly, greater than 65 years of age. That is the goal. If you're more than 65, you're in a nursing home, long-term care facility, you have other comorbidities like coronary artery disease, congestive heart failure, sickle cell disease, you're immunosuppressed, any lung issue, chronic lung issue, i.e. COPD, asthma, you have chronic kidney disease with use of dialysis, anything that can weaken your immune system whatsoever, BMI greater than 40.
Mm-hmm.
Obesity, the risk is you have a smaller lung volume. Again, anything that affects the lungs, you're at risk, basically. Pregnancy, you know your immune system is already compromised while you're pregnant. So those little things, especially pregnancy, we don't know too much about that because we don't know the risk for the baby. So we're just going to be cautious and put them at the at risk zone. Again, anyone without the spleen, as we all know, spleen is one of the safety barriers for the human body. Without the spleen, there's a lot of things that can occur. This happens again with people with the sickle cell disease.
Yes.
So we need to be cautious, and people that have liver cirrhosis. So anyone that has all these chronic comorbidities and you're immunosuppressed, please protect them.
And like you mentioned, sickle cell disease, that is very important because that is one of the most, especially if we consider the African population, sub-Saharan Africa in particular, and the Mediterranean region, sickle cell disease it's very high in those areas. So people should should understand that and take care. We have those people there in our population, and so when they mention the preventive measures, please know that it's not all about you. It's all about there are other people living in the community. And I have a picture here which I will show later when we start talking about the prevention, which Arnold sent to me. Okay, so then my next question would be we'll go to Arnold then. So should I worry about COVID-19? The reason I'm asking this question is because a couple of days ago, some youths in the Florida region were seen partying, despite partying, doing everything in the beach. Despite all these measures, we've also seen that in Cameroon. That I really didn't want to go into this, but it's very important. I have to mention it because I want to keep it as apolitical as possible. The Speaker of the National Assembly was asked to. Everyone was asked to quarantine, but the Honorable Speaker, who is the first supposed to be the keeper of the law, didn't take this regulation. So, should I worry? Should anyone out there be worried? And if so, why should they be worried?
Yes, I'm going to answer that question with yes and no, right? Let me start with the yes. Now, you should be worried because, you know, some few seconds ago, Mah-Fri was giving us, you know, a number of people who are, or the categories of people who are at the highest risk. But you know what this pandemic has taught us is that some people who have been in perfectly good health, like, you know, according to what we can measure and what we can see, have had severe disease, right? So I would say yes. In that case, because you don't know whether you exactly have severe disease as an individual, you know, when we talk about population level, I'm coming to population level when I'll be talking about no, but right now as an individual, you may not exactly know whether you're going to develop severe disease and even die from that. Our statistics have been showing us that, you know, half of the cases who have been having severe disease have been less than 65 years old. So you shouldn't, you know, you should, I mean, it should give you some sense of worry, but not the kind of worry that's going to paralyze you, the kind of worry that should make you to take action, you know, which we'll be getting into when we'll be talking about preventive measures specifically. So that's one reason why you have to worry. Another reason why you have to worry is that you, and when I use the word you, I'm not talking about you specifically, I'm using generic you. You have to look at the health system within where you are found, and the capacity of that health system and the healthcare system to manage cases that are coming in right now. And so if you don't see that and see that this disease, this COVID has the capacity to overwhelm the system, you know, if you don't see that as a problem and as an issue that is going to cause you to worry and take the right decisions and preventive measures, you could be contributing towards overwhelming the healthcare system of a region. It could be of a state, it could be of a country, it could be of a county, you know, or just your primary care physician, whatever system that people go to get health could be overwhelmed, you know, by us not worrying and us not doing the right things. So because of those two reasons that I can immediately spot, I would say yes, be worried. Now, on the other hand, I know I want to balance my answer while I said no. I would say as a young person or in general, what the numbers are also telling us so far, and I know many people have been reading on these, they have seen this, most cases would be mild to asymptomatic, most cases, you know. So to put that in numbers where it can be understood, when we talk like 80% of cases would be mild or, you know, and only like 20%. So it means every 10 people that you meet who are going to have COVID-19, 8 people probably wouldn't have, severe disease out of every 10 people that you're going to meet with the disease. But you are going to have 2 people who are going to have severe disease, and among those 2 people, one person is probably likely going to die. So you have to be worried about not being someone who helps that one person or those 2 people to get severe disease and die. So, but as a young person, or as or in generally speaking, you are not supposed to be very worried that if you get the disease, something, really bad is going to happen. Talking about probability, chance, but you would never know, like I said before, who is going to get severe disease and who is not going to get severe disease, from the start. So
Okay.
that's I'm trying to balance that answer like that.
So that is very good information. We also I've been doing some reading as well, and there is a study which actually showed that there is a possibility that 86% of transmissions are carried by people who are not sick. They don't even know that they have the disease, so they transmit it to others unknowingly. So we all have to be very, very careful. And Jim, the next question goes to you. I have had a lot of people sending me messages and asking telling everyone who has flu-like symptoms, you guys will say in the hospital that is suffering from COVID-19. Is there a laboratory test for COVID-19? So I'm sure you are best placed to talk about that. I can chip in when it be.
Yeah, of course. There is the laboratory test. When this outbreak was announced, within the first month, the Chinese were able to publish the sequence, the DNA sequence of this virus. It's about 30,000 kilobase. It's on PubMed. So molecular biology laboratories are able to construct primers and do a real-time PCR technique to be able to detect the virus. So any laboratory that has a molecular biology unit should be able to identify COVID-19. So yeah, and there are other amino acids that could be used, but the most common is just PCR amplification of the gene and the eventual identification of the viral sequence. Yeah.
Okay, fantastic. So for people out there who think that physicians are just guessing in the hospital that they are suffering from COVID-19, yes, there is a test. And usually when patients go to the hospital, they don't only look for COVID-19. When you present with those symptoms, they do have tests that look for the other flu or influenza virus, influenza A, influenza B. They do tests for that to rule those ones out before they even proceed to COVID-19. And like Jim mentioned, there is a PCR-based, the molecular biology-based technique which identifies different genes produced by this virus. And what is done is that they don't just do one, they don't look for one gene, they do the first one, and if it's positive, if they find that gene in the patient sample, then they proceed to do a second test to confirm. So it's not guesswork. When they say COVID-19 is true, it's true. And if you test positive, then the results are, in most cases, in 99% of cases, is true.
Terence, let me reiterate on the point about testing. So, like you both rightly suggested, the first thing is you have to make sure it's not the flu. So that can be done at the clinic basis, like outpatient. That's what we do. We make sure it's not the flu. You should be negative for the flu, and you're still having symptoms. You go to the next testing, which is like a viral panel. We need to make sure it's not a respiratory syncytial virus. We need to make sure it's not the regular viruses that comes with the common cold. And then when you pass that step and you're still in an acute phase, you're still having issues, then we go over to start testing you for the COVID-19. But if you came out from a level 3 zone, the high endemic zones, we can actually go bypass the step 1 and 2. The step 1, we must do it though. We make sure it's not the flu. We can actually bypass the other viral panels to just go straight up to testing COVID-19. Is that right, Jim?
Yeah, that's very right. Yeah.
Okay.
And I want to also mention that there are, when we talk about case definition, you have usually before we even go into doing some kind of laboratory testing, you have what they call probable case, you have what they call suspected case, and then you have confirmed case. So at this level of defining it and categorizing it, whether it's probable or it's suspected, it doesn't have anything to do with the lab. It's just based on clinical assessment, history taking. And then once the physician is concerned and wants to really identify if this is COVID, and then they send your sample, they collect your nasopharyngeal swab, you go to the lab, that's collected, it's been tested. If the results come back positive, then you are labeled as a confirmed case. So sometimes people get this confused when you hear that there are 300,000 cases, there are 100,000 confirmed cases. Some of these cases are still suspected. But once it's deemed as confirmed, it means the lab has tested your specimen and the viral sequence has been identified. So you are deemed a confirmed. So it's only the lab that can confirm that this is a COVID patient, so to say.
Okay, great.
Can I add something real quick?
Yes, please do.
I just want to say, we're talking about testing right now, and I have heard, some people want to get tested. Some people are sometimes worried, angry, different reasons that they are not, they're not getting testing. A while ago I mentioned about, overwhelming the system that is in place. So I just wanted to say, adding some water to his brine, that we put these algorithms in place so that we can, kind of filter out, from probable case, going through all of that, right up to confirmed case, so that we can try to filter out those who really need testing. Because the truth is, we would love to test everyone, but it is not feasibly possible, if I can combine those two words together, to test everyone. So epidemiologists and public health practitioners, coupled to clinicians and our laboratory folks, have to come together and form, put together a system in which we can funnel down, we can taper down the number of people who are really going to get tested. We don't want to imply that systems are always perfect, but again, that is to try not to make sure that resources are being used rightly. It will not make sense to test someone who, let me say, at the beginning of this pandemic, who had never been in contact with somebody who came from a region where there was an infection going, to just test that person because the person came with, a runny nose and cough, because that would, be losing testing people who really do not need the test. So I just wanted to add that. That's why, because I know that's a question that comes up, usually in discussions and things like that. I just wanted to throw that out there. Okay.
And it's also important, just to add on what Arnold mentioned, in terms of overwhelming the system, it's also important we know that while COVID-19 is here, people who are suffering from other diseases are still there. And so it is very important that resources be directed to those who need them. So if you are not a probable case or a case of a suspected case, if you work as an IT expert who is usually at home, you don't go out quite often, and then you have flu-like symptoms, it's very, very unlikely that you acquired COVID-19 from your computer screen. because you haven't left the house. So that is why when you go to the see a physician, he might think that, okay, yeah, maybe COVID-19 testing is not the right test for you to do at this time based on your exposure. So now we'll move to the most, I believe, the most important aspect of this conversation. And I'm going to leave it for the three of you to just discuss. How can we prevent ourselves and everyone else from having COVID-19? And Mah-Fri, I'll start with you because you haven't spoken for quite a bit. So we'll start and then we'll go around the table.
I've been actually talking. I've been texting back online, so not physically, but I've been replying to.
Concentrate on me and leave the floor online.
All right, I'll try. So prevention. We're gonna start number one with quarantine. Okay, I actually just realized what quarantining means. To be honest with you, it's just separating anyone that is exposed to a contagious disease. You separate them and keep them in for like 2 weeks with incubation time. If they have no symptoms within that time, then they're good to go. So we're gonna quarantine, like Jim said. Social distancing is very good. That helps us also to flatten out the curve and gives healthcare time to prepare just in case it gets worse. Wash your hands. Wash your hands. At least 20 seconds. Like my daughter's school, they taught them how to sing the happy birthday song. So sing it to yourself every time you wash your hands. By the time you're done singing happy birthday, it's 20 seconds. So you're good. Soap and water. I do it. I never used to, but I do it now. Sing happy birthday to me, believe it or not. Clean and disinfect all surfaces, okay? If you do have a fever, isolate yourself until you know what's going on. Please call your doctor. Do not just come into the office because you have a fever. Call first. We can triage you over the phone. We can make sure that it is not the virus, and then we can have you come in. Because when you put us at risk, we put a lot more people at risk that comes in through to see us. Socially support anyone that has the CV-19, the coronavirus 19. Please, it's not a stigma. The more we make it, the more we stigmatize people, the more the virus is bound to spread, because we already know what happens when we stigmatize anyone in society. They get upset and they want to spread it. Unfortunately, that's exactly what happens. So I don't know if I need to add any more about the hand washing, social distancing, quarantining yourself, isolation. That goes to Dr. Jim in the hospital and probably Arnold as well. And they're going to isolate you until after you are basically fever-free without medications for 24 hours, and you test negative consecutively twice in 24 hours, correct? So twice in 24 hours consecutively, you're good to go. So I think that is about it for me, except someone else has anything to add. And monitor your fever, keep monitoring your temperature. Fever is 100.4, not less than that. Fever 100.4, but we start worrying about healthcare workers from 99 degrees. So I think he has something to say about that.
I'm saying most of the people watching are used to SI units. We prefer the degree Celsius. We use the Fahrenheit. It throws some of us off.
Oh, gracious Lord.
So you're throwing me off guard. Now let one of you answer that for me, please.
Okay. All right. So Arnold. Okay, Jim. I know you still have more methods of isolation, but more methods of prevention. But I'm going to stick with prevention, but I will try to phrase a question. Why are all the countries, so that will go to you and Arnold, so I will start with you, Jim. Why are all these countries taking all these measures?
Who is starting, Jim or
Jim, yes, yeah.
What is the question, Terence?
Why are all the countries in the world taking all these measures? Yes, social aspects, shutting down the borders, shutting down the temporary closures of schools and daycare. You can go to an extent. Arnold will continue, so you have help. I know it's a very long list. So the reason I'm asking this question is because I want you guys to tell the people why all these measures are taking place? Because a lot of people are asking, why are they not letting me to go to the shop? Why are they closing the daycare? Why are they shutting down schools? The children didn't travel.
Okay, so let me answer this question very simply. For a disease, in this case, for a respiratory disease, to be able to maintain its transmission, there must be a portal of exit, there must be a portal of entry. There are 6 factors, but I'm just going to dwell on these 2, the portal of exit and the portal of entry. So the portal of exit, for example, for COVID-19 is what? Is sneezing, is coughing, is speaking, anything that enables the virus to get out of your system is a portal of exit. And when the virus gets out now, for it to infect another person, what we call the portal of entry, that person has to be in close proximity to you, like what Dr. Fomukong said, 6 feet or 2 meters. So what the government is doing as far as social distancing, closure of schools, is to avoid that congregation of people. Because if you are in a classroom, obviously you're sitting in a row, you are probably less than 1 meter apart. So it gives the opportunity, if someone is coughing or is sneezing, the virus can spread to the next person. So as a way to cut that chain of transmission, the government is trying to avoid people gathering, either in schools or in concerts or in restaurants or wherever. The government is trying to mitigate that exposure risks. And again, some countries have closed their borders, like there's no incoming flight or there's no outgoing flight. The reason is because there are countries that have been deemed highly impacted countries like China, countries like Italy, like Iran, and other countries. Now like where Monique said, you know, the epidemic or the pandemic has spread to at least 160 countries in the world. So almost every country in the world now is impacted, at least most countries.
Actually, 177 actually. So,
okay, 177. So you see the number keeps increasing every day. So it means once your border is open, people who are coming from highly impacted countries will be bringing the virus or disease to your country. And you cannot control it when many people get infected. You know, it's going to be really hard to contact, trace them, and things like that. So those are one of the 2 main reasons why there's closure of schools and other, you know, businesses, while there is a closure of airports and other border areas within the country, just to check who is entering and who is going out. Yeah.
Okay, Arnold, I don't know if you have something to add. So you go ahead and add, and then I will have another question for you. You had sent me something yesterday, which I believe
right now looks like a good time to.
Yeah, what I'm going to do is I'm going to put one of you, Jim, you just spoke, so I'll put it on the lobby and bring up that image, because it's very important for people to understand that. So Arnold, while you are talking, I will go ahead and do that, so you can continue answering the question on some these measures, why countries are taking these measures.
Yes, I just wanted to add, I mean, I think Jim gave a really beautiful, concise response. But I just wanted to say that with public health, right, we don't necessarily need to have a treatment to a disease to be able to contain it. That's one of the beautiful things about, public health. We just need to know how the disease is transmitted, its incubation time, all those details about a particular disease. And once we know that, then we now look for ways where we can intercept that disease. So even, for example, if COVID had no treatment and no vaccine, these measures now that countries are putting into place can prevent its transmission from one person to another. Jim was just saying that you need a way for the virus to enter, and then you need a way for the virus to come out and go. Mah-Fri had already said that, we know the average length of projection of our aerosols that are produced by us, droplets, if you want me to use that term, which can potentially contain the virus. We know of, 6 feet. Let me put it in meters so that we can understand. It could potentially go like up to 4 meters away, but on average, it goes like, between 1 and 2 meters away. And that's why we give that distance from, every droplet that we produce. But because we know those methods, then we can put into place these stringent methods to hold people back. Like when we say quarantining or isolating oneself, it does exactly what you can see in this diagram, which is it's a simple diagram or a simple picture that I saw yesterday, and I loved it very much because it really explains to us what our social distancing does. You see a string of matches heads that have been burnt, and by just pulling one out of it, it prevents the others from catching fire. So right now, countries are really putting into place, I would say, one, to be able to, to contain the infection, but not only to be able to contain the infection, but to be able to control the infection. Because once you have now a closed system, it is easier to monitor what's going on in a closed system. If you have an open system, it's hard to monitor exactly what's going on. Right now, if you have been following the news, we heard that for the past 2 days or so, China has now registered new cases. So that's because they have a closed system in which they can monitor. That's why they can know they haven't had a new case. If now people were coming in or going out of the territory, you wouldn't know whether you're having new cases coming in or not. So that's another important thing why you see countries are all creating these closed bubbles. They're creating these bubbles so that they could better monitor what's going on within. So that's what I would add to what we have been talking about. Countries.
So, thank you, Arnold. So I believe everyone. So let me try to put the put that MASH picture again. You can see what social distancing just by one person obeying the rule of social distancing. You see how they have avoided the entire a family from getting burned. In this case, and if we are talking of a disease, in this case, an entire family from getting the infection. So Arnold, I'll go again with you. So if you are a public health officer in Cameroon now, what advice would you give the people of Cameroon? That is very important in terms of preventing the disease, because it is imperative. You know how our markets are, you know how the burn seconds do. So what will you tell the people?
Our countries are really hard. It is, this is really difficult right now because when we have been discussing in various fora, and we would say things like that some people for them to survive, they live on a day-to-day basis, for them to be able to have the little they are going to put on their table, they have to go on a day-to-day basis. So right now, I've really been thinking about this. I didn't even know you're going to ask me this question. And I'm going to say something. Maybe it's going to sound crazy to some. But I'm going to take an example that I saw. When I was back in Cameroon, we used to have a driver. He happened to, I don't know whether he was attached to his religion or was attached to his culture. But he was Muslim, and he was from the north. One thing I realized that he always carried was a bottle of Tangi. Like the water inside was not Tangi water; it was ordinary water. But he always carried a bottle of Tangi, and anytime we would stop to to release ourselves of bodily fluids that had accumulated in our bladders, he will finish. And while some of us will casually, walk back maybe to the car or something, I was not part of those who walk back to the car, obviously. No, I wash my hands. But he will go with his bottle of water, and he would stoop, pour water into his hands, and I don't know whether he used to have soap or I don't remember, but he would wash his hands with his bottle of water that he always carried around. And so while I was thinking, because I know some people, like to be cynical when we say, oh, the government is advising us to wash hands. How are we going to do it when we don't have water? It's true, we don't have water. But, there are simple measures like that. You could carry your bottle of water on you, close to you, wherever you're going to when you step out during the day, such that if you find yourself in a place where you have, I don't know, come in contact with people or with surfaces or something, you will not have to wait, till it's late, but you could go on the corner and wash your hands with your bottle of water you're carrying. It may sound crazy, but in these times, they say desperate situations call for desperate measures. So if you have to do that for this 1, 2, 3, 4 months to come, that would be great, But one thing I'm going to add is that if you're back now in Cameroon, try as much as possible to go out only if it is necessary. Like, do go out if you probably have to do groceries, if you have to go and buy, your groceries for the week or so. Please limit the amount of time you're spending out there. Once you go and you get your groceries, because those are things that are important right now for survival. Once you go back and you come back to the house, first things as you're stepping into the house is to wash your hands. Those are things, small things that we forget. So I'm saying it again. Carry your water. If you're a worker or you have to go out during the day, carry your water. Carry your soap or something. Wash your hands with that. It's not going to kill you for these 3 or 4 months to come. Go out if it is like only really necessary for you to go out. I heard now that it's not only now, but most mobile operation companies like Orange, MTN, Nextel, they're all facilitating online payment of bills, for example. So you really don't have to say, I have to go and queue up somewhere to be able to pay my bills or for that. So those are all methods to exploit. I read Orange said for the few months to come, you could pay you could pay whoever with Orange money, which yes, that's helping you. Not only you're not going to be touching physical money, physical cuts, but it spares you that it allows you to properly socially distance, if I can say that. So if you're really back in Cameroon right now, I think that's what you should be doing, staying indoors as much as possible. And obviously, if you get symptoms, if you have symptoms, you should present yourself, to be checked. One thing I want to precise is that for whoever is listening to us back from Cameroon, we have heard tales of many people who traveled and they came back into the country and they didn't respect the quarantining. It looks like the example came from up, trickled down, or it came from down, trickled up. I don't know, but like we said, we don't want to enter into politics right now. But I just want to say that please try and keep yourself home. You may be feeling well, you may be asymptomatic, you may have mild symptoms, but your neighbor who may eventually get it from you may not have mild symptoms, may get severe disease. And so we want to be collectively as a people, not only looking ourselves as individuals, but collectively as a people, taking care of one another in these times, because
very important.
Taking care of one another in these times, because we are still to face, the bigger wave, at least for us back in Africa and specifically for Cameroon. Our bigger wave is still to come. We haven't yet had that big wave yet.
Okay, thank you very much. Just to add to that, I'll ask Jim and Mah-Fri if they have anything to add, but I would just like to mention as well that it is very important that we take some of these measures. I know the population in in sub-Saharan Africa and in Cameroon in particular, it's a young population. So the youth will always say, yeah, we are not the high-risk group, we are not vulnerable, but we also have to understand that most of the people who have died are people who are not suffering from one disorder. Malaria in particular is very, very high in our region. We have people suffering from tuberculosis. We have people suffering from sickle cell, like Mah-Fri mentioned. We have people suffering from HIV. Some of these people are immunocompromised. So it is very easy for them to have and exacerbate the disease they have already. So don't think that, oh yeah, I'm young, I'm not sick. Or it doesn't mean that there are not people out there that are sick. So please, listen to what these billion individuals are saying, and please try as much as possible to follow those measures. Wash your hands and avoid crowded places. I don't know if Mah-Fri or Jim have anything to add. I have some interesting questions here for you as well. We are running towards the end of the show, but I think there are some of these misinformation that have been circulating. So before we go there, maybe you guys have one or two things to add to what Arnold said, especially in the Cameroon context. Jim, you?
Okay. So I think if we're talking about prevention from an individual perspective, it's one thing. We're talking about prevention from a country or a state perspective is another thing. So I'm guessing that the focus of this question is more on the country, right?
Yeah, you could go both ways. I'll probably start from the country, from public health measures implemented by the country. I think Arnold has discussed most of the individual ones, so maybe you can talk about the country.
Yes. So it is the country's responsibility first to monitor those who are coming into the country. I can tell you that most of the cases we have seen in Canada, more than 70% have been linked to international travel. People who came from highly impacted countries, or people who had contact with people who came from highly impacted countries. So for African countries that are beginning to see an escalation of the disease within their population, the first thing to check is who is entering the country. So all, airports or wherever, borders should be monitored. There should be restrictions as to, closures of flights or, entry into the country, visa cancellation, things like that. They have to do those checks and balances so that they have to monitor who is entering or who is leaving. And the aspect of which I know most countries have already done, closures of schools and not only schools, even churches. I know Africans like their churches, and they believe that when they go to the church, the virus cannot attack them in the church because Holy Ghost fire is gonna, destroy the virus in the church. But churches have to be closed. I'm sorry to say that I'm a Christian. They could use other platforms. Nowadays, people, run churches even on Facebook Live, even on FaceTime, other people, Skype, and so on. The whole effort of this is to avoid people congregating together because that's how the virus spreads. The virus spreads by droplets, and it takes advantage of close proximity from one person to the other. And if we kind of breach or kind of prevent that overcrowding, we are indirectly preventing the virus from jumping from one person to the other. And the virus is also transmitted by contact.
Yep.
What that means is that if you go to a shop and you have a 1,000 francs note and you give it to somebody, if you are potentially contaminated, that person takes that 1,000 francs note and you bought something for 800, he gets 200 francs balance and gives to you. You guys are exchanging, the cash And if you don't do hand hygiene, and you happen to touch your face, like all of us do from time to time unconsciously, you can potentially infect yourself. And one way to mitigate this risk is also the aspect of regular hand hygiene, which Arnold emphasized on. And the population has to also be sensitized on cough etiquette. So yeah, the media can be used to sensitize the population on cough etiquette or respiratory etiquette. What does that mean? If you are coughing, the first thing you should do if you're in a group where the other people is to turn away from them and then cough under your elbow like this. In the past, I used to see people cough like this. They put their hand as if they're holding the microphone and they cough. And they don't have even a place to wash their hands, and the next time they are greeting somebody else. So you cough under your elbow. In case you use tissue, you dispose of the tissue, make sure you are washing your hands immediately afterwards. But the preference is to cough under your elbow, because sooner or later you're obviously going to be greeting someone with your hands that are not good. So I think there are a lot of things that developing countries can do. They can encourage the use of credit cards or debit cards where people don't have to touch anything. Nowadays, you just need to take your debit card and put it on the machine and you pay your bills. Someone mentioned that you could pay your bills online. So there should be that limited contact between people, either based on sharing of devices or sharing of materials and things like that. So I'm going to leave it at that point and give Monique the opportunity to weigh in as well.
Yeah, fantastic. I think you may have covered much. I have the next question coming to Mah-Fri, but I would just like to mention that in terms of the country context, especially here in the West, there are several measures, especially people start working now at home. I think this is the time that our country has to encourage the use of computers in offices. I know people like paper, they like their papers, just like you mentioned, they like their churches, they like their papers, they like that when you come to their offices to see a bunch of papers. I think we don't like accountability, that is why we like paper. But I think this is the time to start using computers. Then you limit the amount, the amount of time you contact people. So someone can be in Mah-Fri, instead of them going to an office, they can easily access what they are looking for, that information on the computer. So before we go to the last part of the program, which will be talking about some of these misinformations, is there how do you manage a patient? Is there any treatment for this disease? I know a lot of people have been seeing chloroquine. So what is the how do you manage a patient? Can chloroquine treat this disease? Is there any out there that has shown that chloroquine cures COVID-19?
I really would have loved for us not to go there, but yes, we still have to, demystify the whole chloroquine, hydroxychloroquine.
I apologize for going there, but like, it would have been unfair to the audience if I didn't go there.
Absolutely. So about chloroquine or its closest relative, hydroxychloroquine, that's being used for disease-modifying issues like rheumatoid arthritis. Let me start from the first part. Yes, the only thing we can do is symptomatic treatment, by the way. Symptoms are saying you have a fever, we give you Tylenol. If you're in the low risk group, i.e., we're monitoring you from home, your illness is not severe. The quarantine group, we can give you the Tylenol for fever, we manage your cough, we manage your cold, we manage even your shortness of breath with PRN or albuterol. We can do that. Okay. Now, when we move over to Jim and Arnold into the hospital, this is where we start talking about plus or minus hydroxychloroquine or chloroquine. Okay, this used to be used to treat malaria back in the days, was pulled out of the shelf because of its toxicity. Again, it's back. Okay, it's back just because, as I said, I really wish we never brought it up, but it's all under trials, it's all under investigation. It is used for the very sick. I hate to use this word. Those we do not really know what we're doing anymore. We've tried, and we're just adding stuff now to say, hey, this is going to work. Will this work? Will this not work? There was a study of 24 people. And as you know, being a researcher, 24 is no study. That's some crap. Okay, you cannot base anything on 24 people. You need a cohort of people. You need time, but time we do not have. Okay, so we're gonna do the little things we can do. So they went back to the mode of the mechanism of action about the hydroxychloroquine and chloroquine. That's the only way they can use to get back to taking care of this coronavirus. So what is the mechanism of action? I think you even know better than I do on this one. So what they do is they act the kind of their basic, and the virus loves an acidic environment.
Yes, yeah.
So what it does is it neutralizes, it increases the endosomes. I don't want to go there because now I'm going too far out of my scope. Okay.
Yeah, so it changes the pH.
It just prevents, long and short, it prevents the binding.
Cannot flourish in that environment. Yeah.
Please, it will not flourish in the environment because it's now a basic environment. The virus cannot bind to the mucosal surfaces. It prevents replication. But like I said, it's trials. It's being added with another drug. I'm not going to call that drug's name because we're now going to start buying these things. Yeah. It's all trials. Yes, it can be used, but we're keeping it only for the severely sick. Please, don't go out there trying to buy these things or trying to get prescriptions. We always measure risk versus benefit outcomes. That is how medicine works. If you're healthy, your risk versus benefit, the risk far outweighs your benefit. But if you're sickly, very sickly, risk versus benefit, the benefit is going to outweigh the risk. Because the worst risk, death. You're already there. I'm sorry to say that you're there. So we're trying everything we can to bring you back to this side of the earth. So try not to push your doctors, try not to push your clinicians to prescribe you chloroquine or hydroxychloroquine. We have other people that need these medications. We have people with rheumatoid arthritis, lupus. Now pharmacies are running out. Healthcare providers need it as well, and it's running out, especially those in the front lines, emergency rooms, pulmonologists, otolaryngologists, anesthesiologists have to do their intubation, respiratory therapies. We're trying to use this for them as a post-exposure prophylaxis. That's the term, post-exposure. If you've not been exposed, please don't try to get it. The risk outweighs the benefit.
The benefit, yeah. That is very important. And like this is actually very, very important because I've got a series of calls from Cameroon and in other African countries, Nigeria as well, people asking me, I mean, like if you go to the shelves of most of the local pharmacies in Cameroon now, chloroquine is all gone. The side effects, the toxicity of chloroquine is not what we want to discuss here. And you also have to be very, very aware that in sub-Saharan Africa, chloroquine has been used in the past. I know people have moved on to other medications for the treatment of malaria. And there is a lot of chloroquine-resistant malaria strains out there. You don't want that to happen because malaria, I believe, in terms of fatality and mortality, is a bigger problem in this part of the world. Arnold, you will agree with me on that. Okay.
Yeah, I just wanted to add to what Mah-Fri is saying. Like, I don't know if I flip it like this and say, if you get to the point where you are needing chloroquine, trust me, you'll not be home. You'll be hospitalized.
Absolutely.
And it will be medical practitioners who will be on your case. You will not be yourself.
You will not be
you. I want to change my accent there. I want to let it be down to earth.
Yep.
If you get to the point where you have to take chloroquine for this, then trust me, you're already in the hospital with tubes in your nose and something, pushing your chest up and down. 80% of people will get mild disease. A lot of people will get the disease, may even be asymptomatic to mild disease. So
great.
It's for the 20% and above that will eventually find themselves in the hands of healthcare practitioners within hospitals who may eventually need chloroquine. I just wanted to buttress that point again further.
Okay. Yeah. And just to add with the management, there is some evidence there in the literature that things like vitamin C can also help to boost your immune system. So it's not going to prevent you from having the infection. It's not going to cure anything, but it can just help you. Vitamins are important supplements, so consider that as a supplement. It's not as if it's going to prevent you from getting any disease. So then we go to some of the most critical misinformation, some of the misinformations we've been having out there. So I'm going to ask you some of the questions, and I'll probably prefer a yes or no answer, but if you want to explain a little bit, you could go. So chlorine is frequently used in water treatment, and sometimes alcohol disinfectants is used as a disinfectant. Spraying chlorine and alcohol on your skin, will it kill the virus? Will it prevent the transmission of the virus?
Would you want me to? Do you want me to go first?
Yeah, you go ahead. Yeah, go ahead.
Quickly, please avoid using chlorine products on your skin. Please. I don't know how many times I'm going to say, unless you're on a suicidal mission or you're trying one of those things. Don't use chlorine product. Let me put it better. Don't use bleach. I know that I will understand it. That's our common chlorine product in the house. Bleach.
Yeah.
Use bleach on your skin, please. Now, you can use it on surfaces. You can use chlorine. It's good on surfaces. Excellent to clean your surfaces with chlorine. Your toilets, your whatever. You can clean that with chlorine. If the chlorine is not going to destroy it, because sometimes you don't clean like wood with chlorine, it's going to bleach your wood white. It's going to make it white. But if it's like plastic or something, yes, you can clean it very well with chlorine. Now,
and the recommendation, let me just add there before you continue. The recommendation for the use of household bleach for cleaning surfaces is that you do a 1-in-10 dilution. So basically, if you are going to use 10 cups of water to clean your bleach, you use 9 cups of water and 1 cup of bleach. You put 1 cup of bleach and 9 cups of water. That is enough to kill the bacteria and the virus on the surfaces.
And use a glove. If you're use a glove, use a pair of gloves for your hands, because even at that concentration, it would still irritate your skin. Now, as concerns alcohol-based products, and alcohol, let me say alcohol-based products, your hand sanitizer, which has become very popular and which has run out of stock in our various stores and surfaces where we get them from, are based on alcohol, but not just any kind of alcohol. For your alcohol based product to be efficient, it needs alcohol that is 60% and above. So anything less than that, for example, Absolute Vodka, Hennessy, J&B, I don't know, Johnny Walker, all those things are not going to help you very much to rub on your hands unless you're pouring libation in the village. So you have your hand sanitizers. Make sure it's 60% and above for the alcohol.
Yeah,
the main ingredient inside. I know many people too are looking at options on how to do homemade hand sanitizers. Just make sure that you know what you're doing and that the mixture you're creating the alcohol ends up being a 60% concentration or higher. Because if you are getting anything lower than that, it's not efficient for killing microorganisms, including our culprit for the day, which is the coronavirus causing the COVID. So I hope that's concise.
Great. Next question now. I had a lot of questions inboxes immediately. The alcohol and sanitizers went off the market. Drinking alcohol, will it kill the virus? If you drink a lot of beer or liquor or wine, any of you could go at random. Okay, Mah-Fri, you go.
No, and I'm going to leave it like that.
Fantastic, thank you. Don't do that. So I'm going to play an audio. I have a few more questions. I'm going to play an audio Unfortunately, I couldn't play it on my computer for some reason because I downloaded it, but I don't have the application to play this. So the volume might be a little bit low, but I will play it and then I ask you guys some questions. So I want the audience to listen.
My brother, good morning, Papa. Didn't use for the camp for you spray and me reach right for village for all side. Me man no buy tomato. Again now, me they find a fresh tomato cook and chop. Chinese don't keep them people, they don't die for that sick. They don't grind and burn and grind and put out tomato mix and send for Africa. Me Africa they do they die. They don't they take meat for human being, grind and put up for capsule, yellow and red capsule. Send for this side. Me man no buy capsule. Me man no buy any capsule for drink. Me man no buy nothing we come on Chinese right. Me man no buy it. Now people, human flesh, that people they die that sick, right? They send for Africa. Me Africa they don't die.
Okay, fantastic. So there are two things there: capsule and don't eat tin tomatoes. How valid is that information? So Mah-Fri, Jim, any of you could go.
First of all, before I think Jim, do you want to go first?
Yeah, I don't know if you can hear me. My computer went off and
we can hear you.
coming on.
Yeah, we can hear you.
Okay.
You may just, you just want to shift a bit to the back. Your face is cutting. Yeah, fantastic.
Okay. Yeah, it's frozen on. It's kind of freeze from my end, so I don't even see myself. Okay. Terence, you know, I am a scientist. I don't play on facts that are not grounded on evidence. So I am not, first of all, sure about the authenticity of these allegations. And because I'm not sure about something like this, I cannot really give any concrete or definitive advice. We can have some more concrete evidence that what this lady is insinuating is true, then we can work on that. But without a more substantiated evidence, I would not discourage people from eating tomatoes. What was the other thing? The other one was
capsules.
Capsule. So I
take
believe
any capsule medication.
That's probably tetracycline they are talking about. It's a yellow and red. I believe that's tetracycline. That's the one which is usually yellow. I believe, if I'm not mistaken.
Probably.
Yeah.
Yeah. So basically, the long and short of my position is that I need evidence. I need facts to support what she just said. I cannot base my judgment based on an audio that someone just published out without any substance, without any basis. She could be right, she could be wrong, I don't know. But I need more to that to be able to give a definitive public health advice. As far as I'm concerned, that video or the audio does not provide as much evidence for me to support her allegation.
Can I? Okay.
Yeah. Go ahead. Yeah.
Oh, okay.
Any of you?
Okay.
The lady in the house.
Yes, let the lady
go. Thank you, Arnold, for letting the lady go first. I appreciate that, and Terence. So my take on that is, first of all, literature says, because it's, as I say, it's a novel virus, we're still learning as we go along. It's 3 hours in the air and 72 hours on surfaces, okay? So by the time that whatever leaves China and gets to Cameroon, it's 72 hours. So that's my take. So go figure. I think we should be good. But again, go ahead and eat what you want to eat. We're going to practice hygiene all the time. We're going to do everything we've talked about on this debate. And I bet the public health expert is going to come in and tell us what else we need to do.
Yes, I know as a public health practitioner, I learn and some of the hats I've learned I'm trying to learn how to wear. I'll just say at this point where you are trying to go out as less as possible, as feasibly possible. I remember I said a while ago, and that's what we have been saying over and over, go out as least as possible. And one of the ways that's going to help you to go out as least as possible is for you to be buying canned foods, for example. Not every our refrigeration capacity for households back in Cameroon is not as strong as here. And so if you're going to buy fresh tomatoes and fresh things to store, it's not going to be easy.
You have no lights right now as you speak.
Exactly. So it's easier for you to buy tin foods and canned foods, for example, for tomatoes. Most of our dishes that we cook back home, the starting point is tomatoes and onions and whatever. But so my whole point is that go in for what you can conserve for a longer time, if which is going to prevent you from going out frequently to go and buy food. And common sense tells us right now we don't have lights. So what are you going to do? You have to consider options that are going to help you in that sense. And remember, most of our foods back home, we don't eat raw foods. We eat.
That's what I was going to say. Are you not going to cook the freaking tomato before you eat it?
We cook thoroughly. Right. We eat thoroughly cooked foods. We are not fans of half cooked food, and this virus is liable to heat. It's so by the time you are getting your food to boiling temperatures, whatever is inside, probably if there was, I'm still saying, because like Jim said, we don't have scientific facts to back. But I'm just saying, if there was, in the big if there was,
yeah,
you will cook it to death, and you should be fine eating your food.
Okay, so I have 2 more minutes. I have 1 more minute before we end the show. And the last question I'm going to ask you guys is: there are a lot of rumors there in the streets and circulating on social media that Africans, in particular Black people, don't get infected with COVID-19. How true is that? I'm actually putting on my serious face.
Terence, I don't know if you are hearing me or seeing me, because
we can hear you.
But anyone?
Yeah, we can hear you.
Okay. So you want me to take that question?
You could. Since we can't see you, we give you the luxury.
So your question is whether Black people can be infected with COVID-19.
I just wanted a yes or no answer.
Okay, yes. I think they can be infected.
Yeah. Everyone is vulnerable. We've seen a lot of Africans and infected. A lot of people going back to Africa infected. So yes, to stop all those miscommunications and misinformation. And so we've come to the end of the show. I would like you guys to give the audience your take-home messages. I know each of you is going to probably, you might all give the same message, but like give them the take-home message. My focus here will be intentionally on how to prevent others from having the infection. So, Mah-Fri, you go first. The lady, of course.
Thank you all for having us and listening to us today. Thank you, Arnold. Thank you, Jim. And thank you, the Big Debate team, most especially for coming up with this wonderful, wonderful show. I hope we keep going on and we keep moving stronger. My big take on this is very serious. And I apologize to Dr. Onana. This is serious. It should be taken seriously, okay? It's no joke. I see how the hospitals are being overwhelmed. Take heed to everything. Everything your doctors say, everything your state is saying, everything your constituency is saying, please do take heed. Take advice from them. Quarantine yourself if you think you have symptoms or you've been in contact with anyone that may have been to any of these places. Please call your doctor's office before you go in. Don't just show up. Call them and let them know what's going on, especially if you have a fever. Okay? Number 2, monitor your symptoms, hand washing, hygiene. We cannot keep talking about how much hygiene goes a long way into trying to prevent the spread of this COVID-19. Again, listen to guidelines. Read, people. This is the time for us to read. This is new. It's evolving by the day. So we need to be up to date with everything. Go on the CDC website. go to the WHO website, update yourselves, educate yourselves. And yes, come back here on the big debate, shoot a question, ask us questions online. If we don't know the answers, we know where to find it for you and your family members. Please, coronavirus is here. We need to take it. It is very, very, very serious.
Thank you, Doctor, for that extensive overview of the discussion. So, Arnold, I will hand over to you.
Yeah. Please, I just want to say this. What happens in the next months depends on what we are going to do now. I was saying, and I've been telling people around me who know me, in the country where we are right now, I'm predicting the trend is that April is going to be the month we are going to peak. Whatever we are seeing now, we are still in the ascending. We are gently ascending. April is going to be our month where we are going to peak. I'm not saying this to scare you. I'm saying this so that you understand. It's like watching a tsunami coming. You know,
Yep.
It's distant, it's traveling very fast, but from your perspective, it looks like it's slow and it's coming, and you cannot yet gauge its strength when it's going to hit. And so we should not wait for it to hit in its full power before we start crying and trying to run and do things. I think there's a country right now that I still repeat it to people around me. There's a country right now that if you want to know how bad that this epidemic can be when it hits with its full strength, if you need an example and you have not been seen or you are still doubting, just take a look at what's going on in Italy right now, and look at the numbers that are coming out from there in terms of number of people dying every day. I think it's going to open your eyes to what could potentially happen if this virus and this disease hits full force. And so I say it again, what happens in the months to come depend on what we are going to start doing now, and what we are going to start doing now as individuals and as groups of people. Groups of people could be neighborhoods, could be cities, could be counties, could be regions, could be countries. What we are going to do collectively and individually is going to determine how the curve is going to be in the months to come. So please, wash your hands, stay away from others as much as you can and as much as which is feasible for you to do. Take precautions, basic hygiene measures that you have heard over and over. They are very simple to do, so simple that you could forget them. But please, those are methods that are tried and true. Countries that have enforced these measures very strictly, we can see how they are reaping, the benefits right now, with their curves flattening out, with the number of cases per day dropping, and some cases, some countries are not even anymore. So we should put all of that together in this perspective and understand that now is a moment where we all have to come together, but we also have to take our individual responsibilities.
Thank you very, very much, Dr. Arnold. And Jim, your last word, if you can hear us.
Yeah, I can hear you. Can you hear me?
Yes, we can.
Okay, so sorry, my system had been on and off here. My computer kind of went off and I had to switch to my phone, and it doesn't seem to work so well with the phone. This has been really an interesting conversation, and I want to say that for the population, you can protect yourself and you can protect your families and friends. We can continue to highlight on these measures, and they are not so difficult. They are things you can do. Practice cough etiquette, cough in your elbow, cough away from people. If you use a tissue paper, wash your hands afterwards. If you are sick or feeling sick, flu-like symptoms, stay home, contact a healthcare practitioner, monitor yourself, practice social distancing. You can hold on from going to church at this time. and stay at home. You can hold on from going to the nightclub at this time. You can hold on from going to, those concerts and so on and so forth. Stay safe at home. You had a trip that was planned or you got a visa that you had to travel to China or to Iran or to wherever in the world, in Italy, in the USA. Keep that visa. It might expire. That's not the end of the world. Stay home, isolate yourself, avoid travels at this time until when this whole saga comes down. Hand hygiene, said it and we said over and over again, it's the main way to prevent the transmission of most germs, including the COVID-19 causative agent, SARS-CoV-2. Wash your hands as often as possible. If you don't have water and soap, you can use alcohol-based hand sanitizers. So these are basic things that you can do. You can also keep yourself healthy. Once you have a strong immune system, most infections, not only COVID-19, your immune system can really, really be your first defense, So yes, the population should just, stay tight, observe these basic guidelines and keep safe. So once again, Terence, thank you so much. And it's been a pleasure to meet the other panelists. And we hope we continue this discussion in the near future.
Okay, great. Thank you, everyone. Thank you, fellow panelists. I was very delighted to have you here. We're supposed to be here for an hour, but the discussion was so interesting and necessary, we went over the time. So I would also like to express my sincere thanks to the members of the fantastic members of the team debate. So Mboli Nani, Elizabeth Yonkuma, Omar Bayen, Deep Ayuk, Tres Katos, and Frunix, not in any order, for all the work they do to ensure that this happens. And to all our members of the audience and fans, we very much appreciate. Hopefully you will take this message, you hear this message, share these videos to people we'll convert it into a YouTube and we'll share it on the Big Debate page. You can share it to as many people as you can. Thank you very much and have a wonderful evening. Good night.
Thank you.